morning, everyone. This week's subject on JNTA 14 News is Anatomy 101. And today we'll be discussing joints. Julia, did you know how important our joints really are?
You know, I really don't think about it that much, but I do know that joints are necessary for movement.
That's right, Julia. Our joints do many things. They hold our bones together and give our skeleton mobility.
You know, we always use joints, like when we run, or sit, or walk, or jump, or leap, or hop.
Well, Julia, there are two ways we can classify our joints, structurally and functionally. Functionally focus on the amount of movement the joint allows. There are synostosis, ankylosis, and dirosis.
Now, Nadia, what in the world do those mean?
I'm glad you asked. Well, synostosis means immovable. Ankylosis means slightly movable joints, and dirosis means freely movable joints.
So dirosis joints are like the limbs.
That's right, Julia, and the other two are in our exoskeleton.
And that's the skull and the spine. Now, structurally, there are different types of joints, such as fibrous, cartilaginous, and synovial joints.
I think it's time that we go to Tabitha to get some more information on this subject.
I think you're right, Nadia. Tabitha, are you there?
Right here, ladies! Okay, so now we're just going to do an activity to kind of review the information over joints that Nadia and Julia just did. So we're going to bring them out and do this activity. Okay, so I'm here with Nadia and Julia, and we're going to do an activity to review the three types of joints that they talked about. Starting off with the fibrous joint, which is, when you think of fibrous joint, you think of your sutures in your skull. So to represent this, we're going to do the movement like this. And then now we're going to move on to the cartilaginous joint, which is your pelvis. And so you're going to do around town to represent that move. And then last but not least, we have the synovial joint, which is your knees. And so we're just going to do the Charleston to do that. And so now we're going to get to the activity. Hit the music. So whenever I call out the type of joint, just dance out this type of movement that I showed you earlier. Fibrous. Cartilaginous. Synovial. Cartilaginous. Fibrous. Synovial. Fibrous. Cartilaginous. Nadia's choice.
Synovial!
Julia's choice.
Fibrous!
And last but not least, cartilaginous. Alright, good job, guys.
Woo! Good workout!
Okay, so now we're going to go more in depth with the joints that Tabitha just showed us. And the first joint being the fibrous joints. And these are united together by fibrous tissue. An example of this are the sutures of the skull, which Tabitha just showed us in the dance activity. And the sutures are the irregular edges of the bones that interlocked and are bound tightly together by connective tissue fibers. There's no movement with the sutures, which keep the skull locked together.
Now moving on to the cartilaginous joints. Their bones ends are connected by cartilage that are slightly movable joints. As we saw in the dance activity, your pelvis is one example. And last but not least, the synovial joints. These joints have joint cavities separating the articulating bones ends. And one good example of the synovial joints is the knee.
You're right, and these synovial joints count for all the joints of the limbs and have 4 distinguishing features, being the articular cartilage, fibrous articular capsule, joint cavity, and reinforcing ligaments. The articular cartilage covers the ends of the bones forming the joints.
The fibrous articular capsule is where the joint surfaces are enclosed by a capsule of fibrous connective tissue.
Then the joint cavity is the cavity enclosed by the articular capsule that contains lubricating synovial fluid.
And the fibrous capsule is usually reinforced with ligaments.
Alright, I think you're right, Nadia. But did you know that we can classify the joints' abilities with the shapes of the bones?
What exactly do you mean, Julia?
Well, the shapes of the bone surfaces are what determine the movements a joint can perform. We can classify them as plane, hinge, pivot, condyloid, saddle, and the ball and socket joints.
That's right, Julia. You can. Like the plank joint is non-axial. It doesn't involve rotation around any axle, and it has short slippings or grinding movements. A good example is your wrist when you ride.
That's right, Nadia. There's also the pivot joint, which is uniaxial, which means the rotating bone turns around its long axis. The rounded end of the bone fits into a sleeve or ring of bone. Next, we have the condyloid joint. An egg-shaped articular surface of one bone fits into an oval concavity in another bone, allowing the moving bone to move from side to side and back and forth, but the bone can't rotate around its long axis. This is called biaxial.
Well, wouldn't that be the knuckles, like when you wave?
You got it.
And the saddle joints are biaxial as well, Julia. They have convex and concave areas. And last but not least, we have the ball and socket joints. These joints are multi-axial, the most freely movable synovial joints around all axes. The spherical head of one bone fits into a round socket in another bone, such as the shoulders when you play baseball or softball.
There are so many ways to classify the body, especially the joints.
Yes, there are, Julia, but there are plenty of diseases to go along with them.
You're right. Let's go to Anna Marie to hear more on that subject.
Well, you actually caught me at a good time, you guys. I'm actually looking up some diseases right now. I have 7 to show you guys. First, starting with a sprain. Now, a sprain is actually very common among sports people, dancers, any athletic person, but it also can happen to a normal person as well. You can get a sprain just by walking down the street. If you step on your foot wrong and it twists, you can get a sprain just like that. You can also sprain your wrist, you can sprain many parts of your body, because a sprain is where a ligament or a tendon, it rips, it stretches, it tears, it extends just a little too far away from the joint, as this picture shows. Now, we also have arthritis, which is very common among the United States. There's actually over 100 different types. It can be very extensive, but each arthritis type has 3 main symptoms: pain, swelling, and stiffening along the joints. Now, a certain type of arthritis is osteoarthritis, and this is actually very common among the aged people. 85% of Americans actually have this disease. What it is the cartilage, it softens and it breaks down and it starts to decay, allowing the bones to rub together. And the disease, as it progresses, it'll get harder and harder, it'll decay more, and eventually bone spurs will begin to grow. The cartilage, when it breaks down, it's not allowing the joint to move. It's just completely restricting the joint. This becomes very, very painful for the person having this disease. Not only called arthritis, you hear it in a different way, but it's called gout. That's our next one that we're looking at. Gout is where acid accumulates in the blood, and it can be deposited as a needle-shaped crystal in many forms in the soft tissues of the joints, as you can see between this joint here and the big toe. This creates a swollen piece wherever the body is, and it sticks out, and it looks very hard actually. It doesn't look like it'd be soft. Spreading away from the arthritis though, we have, lastly, bursitis. Very weird word. Bursitis is this right here, and this looks nasty. What it is it looks very swollen. It can actually grow bigger and bigger and bigger. The way that it works is it's due to the inflammation of the bursa or synovial membrane. Now, last but not least, we have osteoporosis. This is a bone-thinning disease that affects over half of the women over the age of 65, and it also affects 20% of the men over the age of 70. This can actually make the bones so fragile that even a hug or a sneeze can fracture the bones. But, now that I'm thinking of it, we're missing one disease. I left one out, but I think Julia could help us out with this one a little more. Don't you think, Julia?
Thanks, Anna. So one more abnormality we're going to talk about is scoliosis. And I actually have scoliosis and had surgery on it a few years ago. So we wanted to show y'all 2 x-rays, and the first one is my spine before surgery. So if you can see, there's my spine and it's curved to the left a little bit. So this next x-ray is after my surgery, and there are 2 metal rods that they put in my back to straighten out my spine.
Wow, Julia, that was interesting. I never would have guessed you had scoliosis.
Yeah.
Wow. Now, let's take a closer look into some more clinical advantages in bone repair. Some conditions are too severe for bones to effect repair, such as extensive shattering, birth defects, and poor circulation.
You're right, Nadia. And let's talk about some techniques used to speed up bone repair.
Alright, first we have ultrasound. And I know what you're thinking. Wow, let's see the baby in the tummy. No, this is a different kind of ultrasound. This one, it speeds up the repair for fresh fractures. Also, there is the electrical stimulation of fracture sites, which dramatically increases the speed of healing in large and slow healing fractures.
Alright, and next we have free vascular fibular graft technique, which uses pieces of the fibula to replace missing bone. And lastly, there's the vascular endothelial growth factor, which is a protein that stimulates the blood vessels.
Wow, that was interesting. The body is very good at protecting itself and rejuvenating what it really needs. Well, that's all we have time for today. So join us next week for our exciting adventure into the muscular system.
Bye, everyone.
Bye.